In the morning, your legs look completely normal. But by evening, your ankles seem to disappear. Your socks leave deep marks around your skin. Your shoes suddenly feel tighter, even though your feet obviously could not have grown in just a few hours. So, what exactly has appeared inside your legs? Fat? No. Muscle? Not that either. What is making your legs look larger may be fluid that has escaped from some of the smallest blood vessels in your body. And sometimes, that swelling is not simply the result of standing for too long. It can be a sign that one of your body's internal transport systems is struggling to keep everything under control. Why can gravity overpower the circulation in your legs? Why can a valve only a few millimeters wide determine whether your ankles swell? And how can you tell the difference between tired legs and a warning sign that deserves medical attention? If you enjoy uncovering the hidden systems working inside your body, subscribe to the channel, because today, we are going to follow the fluid that slowly moves into your legs. Before we begin, look at your ankles near the end of the day. Do they often look swollen? Type yes or no in the comments. That simple answer may reveal a lot about how much time you spend sitting, standing, and moving every day. When people notice swollen legs, many immediately blame drinking too much water. But your body is not a bottle that simply expands at the bottom whenever more water is poured into it. The water you drink is absorbed, transported, regulated, and removed through a complex network involving your heart, blood vessels, kidneys, hormones, and lymphatic system. Swelling does not only mean that your body contains too much water. It often means that fluid is in the wrong place. Instead of staying inside your blood vessels, some of it has collected in the spaces between your cells. This accumulation of fluid is called edema. Another common belief is this: I cannot have a health problem. I have only been sitting at work. But sitting or standing in the same position for a long time can be enough to make the feet and ankles swell. When the muscles in your lower legs are not contracting regularly, blood has more difficulty traveling upward. Gravity does not need to attack your body violently. It only needs to pull gently and continuously for several hours. By the end of the day, that small force has had enough time to create a visible difference. Sitting for long periods, standing for long periods, eating a lot of salt, pregnancy, and certain medications can all contribute to swelling. Salt is also widely misunderstood. Sodium does not simply travel downward and collect inside your ankles. Think of sodium as a guest at a party who persuades everyone else to stay longer. When sodium levels rise, the body may retain more water to keep its internal chemistry balanced. For some people, this can make fluid retention more noticeable. But salt is rarely the complete explanation. When swelling continues, becomes worse, or appears with other symptoms, simply avoiding salty food may not solve the underlying problem. The most important thing is not to treat every type of leg swelling as if it were identical. Mild swelling that slowly develops in both legs after a long day is very different from sudden swelling in only one leg, especially when that leg is painful, red, or warm. Sudden one-sided swelling can sometimes be associated with a blood clot inside a deep vein. That situation may require urgent medical evaluation. To understand why legs swell, we need to shrink ourselves down to the level of the capillaries. Capillaries are extremely small blood vessels with walls thin enough for water and dissolved substances to move across them. Imagine a capillary as a pipe made from an incredibly fine mesh. Pressure inside the vessel pushes some fluid outwards so nearby cells can receive oxygen, nutrients, and a stable environment. At the same time, other forces pull much of that fluid back into the bloodstream. Every second, your body must balance two opposing processes. One pushes fluid out. The other brings fluid back in. You can imagine this system as a hotel with a revolving door. Some guests leave the lobby to enter their rooms, but most of them must eventually return through the correct exit. Swelling develops when too much fluid leaves the blood vessels, too little returns, or the system responsible for clearing the excess cannot work quickly enough. The space between your cells then becomes like a parking lot that is slowly filling up. At first, you may notice nothing. But once enough fluid has accumulated, the skin begins to stretch and the normal shape of the ankle starts to disappear. This is where the calf muscle pump becomes important. The name sounds like a mechanical device, but it is simply the muscles in your lower legs acting like hands squeezing a tube of toothpaste. Whenever you walk, flex your ankles, or rise onto your toes, the calf muscles contract. That contraction compresses the veins and helps push blood upward toward the heart. When you remain still for a long time, this natural pump becomes less active. Blood can collect more easily in the lower part of the body. Pressure inside the veins of the legs increases. As that pressure rises, more fluid may be pushed out into the surrounding tissue. But the calf muscles are not working alone. Inside many veins are one-way valves. These valves are like small doors on a staircase. They allow blood to move upward, but they are supposed to stop it from falling backward. When the valves close properly, the column of blood is held in place one section at a time. But if the valves become weak, damaged, or unable to close completely, some blood can flow backward and collect in the legs. This can happen in chronic venous insufficiency. People with this condition may notice heaviness, aching, visible veins, skin changes, or swelling that becomes worse later in the day. Varicose veins are part of the same general story. They are veins that have become enlarged, twisted, and visible beneath the skin. There is also another transport network that receives much less attention: the lymphatic system. If your blood vessels are the delivery roads of the body, the lymphatic system is the cleanup and recycling service. It collects excess fluid, proteins, and other material from the tissues. Then it returns that material to the circulation. When lymphatic vessels are damaged, blocked, or unable to drain effectively, fluid may remain trapped in an arm or leg. This is known as lymphedema. It may begin as mild swelling, but it can become more persistent over time. Another feature people often notice is called pitting edema. When gentle pressure is applied to the swollen area, the skin may temporarily remain indented. Imagine pressing your finger into a wet sponge. The pressure pushes fluid away from that small spot. When your finger is removed, the fluid slowly returns. Deep sock marks may make you notice something similar. However, pressing your own skin cannot reveal the exact cause of the swelling. It is an observation, not a diagnosis. During a normal day, do you spend more time sitting or standing? Type one word in the comments. Sitting or standing? Neither answer automatically means something is wrong. The important detail is how long your body remains in the same position without movement. Regular movement keeps the muscles of the legs involved in returning blood toward the heart. Now we reach the most important part. Leg swelling is not always only a problem in the legs. It may reflect what is happening in organs located much farther away. The heart moves blood through the body. The kidneys regulate water and sodium. The liver produces proteins that help keep fluid inside the bloodstream. The lymphatic system removes excess fluid from the tissues. Imagine these systems as 4 departments managing a city. The heart is the central pumping station. The kidneys are the filtration and water control facility. The liver is a chemical factory. The lymphatic system is the drainage network. A weak pump, a damaged filter, or a blocked drain can all lead to fluid collecting where it should not. If you want to keep exploring the invisible systems that control your body, subscribe now, because from this point forward, a swollen ankle can lead us all the way to the heart. In heart failure, the heart is unable to pump or receive blood as effectively as the body needs. This does not necessarily mean that the heart has stopped. It means that its pumping performance is no longer sufficient. Blood returning to the heart may begin to back up in the veins. As pressure increases, fluid can move into the surrounding tissues. That fluid may appear in the feet, ankles, or lower legs. Some people may also experience unusual tiredness, rapid weight gain caused by fluid retention, or shortness of breath. Breathing may become more difficult during activity or while lying flat. Swelling related to heart problems may appear less noticeable in the morning and become more obvious later in the day. But that pattern alone cannot diagnose heart failure. Many different conditions can create similar swelling. The kidneys also play a major role. Every day, they filter the blood and determine how much sodium and water should remain in the body. Think of the kidneys as a highly advanced water treatment plant. They are constantly deciding what should be recycled and what should be removed. When this regulation is disrupted, the body may retain more sodium and water. The total volume of fluid inside the body can increase. Eventually, some of that fluid may move into the tissues and create swelling. The liver is another part of the balance. It produces important proteins that help keep fluid inside the bloodstream. One of these proteins acts like a magnet that helps pull water toward the blood vessels. When the level of these proteins becomes severely reduced, the bloodstream may lose some of its ability to hold fluid. More fluid can then move into the surrounding tissue. That is why a healthcare professional does not only look at your ankle. They may ask whether your weight has changed. They may ask whether you are urinating normally. They may ask about breathing problems, previous illnesses, recent travel, injuries, and the medicines you take. Medications can also be part of the puzzle. Some medicines used for blood pressure, hormones, contraception, inflammation, or other conditions can contribute to swelling in certain people. One group of blood pressure medications, known as calcium channel blockers, is especially known for causing swelling around the ankles in some patients. The name sounds complicated, but imagine these medications as changing how tightly some blood vessels hold themselves. When small arteries widen, pressure can increase in nearby capillaries. That may encourage more fluid to move into the tissues. But this does not mean you should stop taking a prescribed medicine on your own. Suddenly stopping medication can be dangerous. Instead, notice when the swelling began and discuss it with a doctor or pharmacist. Now imagine that you ignore the swelling for several months. When the cause is simply temporary inactivity, the swelling may improve after movement, rest, or a change in position. But when high pressure inside the leg veins continues day after day, the surrounding tissues are repeatedly exposed to excess fluid. Over time, some chronic circulation problems can lead to aching, skin discoloration, hardening of the tissue, itching, or wounds that heal slowly. The body does not always begin with a loud alarm. Often, it sends a small signal. Then it sends the same signal again and again. Eventually, the pattern becomes too obvious to ignore. There is also a more dangerous possibility. Imagine that only one leg suddenly becomes swollen. It feels painful. The skin is warmer than the other side. Perhaps it also looks red. This can sometimes happen when a blood clot blocks a deep vein. A clot is like a roadblock inside the circulation. Blood has difficulty moving past it, so pressure builds behind the blockage. If part of that clot breaks away and travels to the lungs, it can create a life-threatening emergency. Sudden shortness of breath, chest pain, fainting, severe dizziness, or coughing up blood together with leg swelling requires immediate emergency help. Do not wait to see whether it disappears. Do not massage the painful area. Do not assume that sleeping will make it better. Get emergency medical assistance. Swelling also deserves prompt medical attention when the area is hot, very painful, red, or associated with fever. Unexplained swelling in only one leg should also be checked. During pregnancy, gradually increasing swelling in both feet can be common, especially later in the day. The growing uterus can place pressure on veins, and hormonal changes can affect fluid balance. But sudden swelling, especially involving the face or hands, may be more concerning. When it appears with severe headache, vision changes, pain under the ribs, nausea, or a sudden feeling of being unwell, medical care should be contacted immediately because it may be associated with preeclampsia. Which pattern do you think deserves more urgent attention? Both legs gradually swelling? Or one leg suddenly swelling? Type 2 or 1 in the comments. The key answer is 1. Sudden unexplained swelling in one leg, especially with pain, redness, or warmth, is generally more urgent. So, what details should you observe? First, is the swelling in one leg or both? Did it develop suddenly or gradually? Is there pain? Does the skin look red or feel warm? Do you have a fever? Are you short of breath? Does the swelling improve after sleeping, or does it remain the next morning? Did you recently start a new medication? Have you been injured? Did you recently take a long flight or spend many hours sitting in a car? Has your body weight increased quickly over a few days? These details help a healthcare professional see the pattern more clearly. For mild swelling related to long periods of sitting or standing, gentle movement may help the calf muscles pump blood upward. Changing position regularly may also reduce the amount of time gravity has to pull fluid downward. Elevating the legs can sometimes help fluid move away from the ankles. Reducing excessive sodium may also help certain people. But these measures do not replace medical evaluation when swelling is persistent, unexplained, painful, sudden, or associated with other symptoms. Compression socks may help some people by applying controlled pressure to the legs. Think of them as an external support system that helps prevent blood and fluid from collecting near the ankles. However, compression is not suitable for everyone. People with certain artery problems, skin conditions, or other medical issues may need professional advice before using it. Using very tight compression without knowing the cause of swelling may create problems instead of solving them. And here is the strangest part of this entire story. Your legs are not only tools for movement. They are also the lowest point in a living city made mostly of fluid. Every step creates a small pumping action. Every venous valve fights gravity. Every lymphatic vessel functions like a microscopic drain. Every heartbeat sends pressure through an enormous network of tubes. We usually imagine the heart as the only pump in the circulatory system. But your lower leg muscles are also essential assistants. When they stop moving for hours, the entire system must work under more difficult conditions. That means the mark left by your socks is not just a mark on your skin. It is a temporary record of a battle involving pressure, proteins, veins, valves, muscles, kidneys, the liver, the lymphatic system, the heart, and gravity. Most of the time, your body wins this battle without you noticing anything. It moves fluid outward. It brings fluid back. It drains the excess. It adjusts salt and water. It keeps the whole system balanced. Only when fluid begins to remain in one place for too long does this invisible system become visible. So the next time your ankles look swollen at the end of the day, do not panic. But do not ignore a repeating pattern either. Notice whether one leg or both legs are affected. Notice whether the swelling appeared slowly or suddenly. Pay attention to pain, redness, warmth, breathing difficulty, fever, or rapid weight gain. These details can separate a temporary effect of gravity from a warning sign that needs medical attention. Subscribe to the channel so you do not miss the next signal your body may be sending. Because if a small sock mark around your ankle can lead us all the way to your heart, the next question is even more unsettling. Why can the heart become weaker in silence for years before you notice anything?